transverse bands of sclerotic cells. So this is the bignonia. So next one is the cambium forms irregular patches of parenchyma in the xylem. So example is Urtica dioica. So here in this, the young stem of Urtica dioica, which shows a typical dicotyledonous structure that is having the ring of conjoint, open, and collateral. So it is a similar condition dicot stem. That is a conjoint, open, and collateral vascular bundles. So at an early stage, the normal cambial ring is formed, so which behaves normally. Secondary xylem towards secondary side. But however, after some time, the cambium which begins to behave abnormally. So sometimes after it producing normal secondary xylem and secondary phloem, this cambium which behaves abnormally, and it certain places only cutting up the parenchyma cells on the inner side instead of the secondary xylem. So instead of producing the secondary xylem, it producing the parenchyma cells. Okay, parenchymatous cells. So after cutting parenchymatous cells, this cambium again begins to behave normally and again resumes its normal activity, forming the secondary xylem above the parenchymatous group. So this process is repeated again and again, and which result in the formation of islands of parenchyma which are embedded in the secondary xylem or wood. So here what happens? So generally here in Urtica dioica, so that is generally this here. This cambial ring which behaves normally and it is producing the secondary xylem towards inner side and secondary phloem towards the outside. But after some time what happens? This is producing the secondary xylem. Secondary xylem place, it producing the parenchymatous cells. Okay. So after some time, so this parenchyma again it behaves again normally. After producing the parenchymatous cell, again it behaves normally and again it producing the secondary xylem. So this process will be repeated again and again. So it which resulting the islands. So in between these parenchymatous islands, we can observe the parenchyma in the xylem region. So islands of parenchyma which are embedded in the secondary xylem. So this is another reason of anomalous secondary growth. So like this. So in secondary xylem band, so it is again altered with the parenchyma band. Again secondary xylem. So it is only taking place inside. In place of the secondary xylem, it is producing the parenchyma. Like that, it shows the parenchyma islands. So this is the another reason. So another